I'm Simon Travis, Professor of Clinical Gastroenterology here at the University of Oxford, and I'm Chief Investigator of the HarbOR study, which is investigating V565 oral anti-TNF therapy in the treatment of moderate to severely active Crohn's disease. We know that anti-TNF therapy works for moderate to severely active Crohn's disease. This gives us the chance to test oral therapy, which will get round the problems of parenteral administration because it will provide gut-specific immunosuppression without systemic immunosuppression and is a real option for the future treatment of Crohn's disease. It's the first study of oral anti-TNF therapy which provides the potential benefits of anti-TNF therapy without the systemic immunosuppression caused by injectable agents such as adalimumab, golimumab or infliximab. Furthermore, there is good evidence from patients with inflammatory bowel disease that the oral anti-TNF therapy engages with its target. Any patient you're thinking of starting anti-TNF therapy. Second, any patient that you're thinking of starting oral immunomodulator therapy, such as azathioprine or methotrexate. Thirdly, any patient who is steroid dependent. And fourthly, people who have had anti-TNF therapy in the past to which they have responded, but have then stopped treatment for a variety of reasons, which may be just injection site reactions, it may be because they couldn't afford it, which matters in some healthcare systems, or that they've decided to stop it of their own accord. Anti-TNF therapy is the gold standard for treating moderate to severely active Crohn's disease. We've got evidence from studies in patients with inflammatory bowel disease that V565 taken orally gets into the tissues and it neutralizes TNF. In other words, it is shown to demonstrate target engagement, and that's the sort of thing patients can understand. And thirdly, the advantage of taking oral therapy, which does not cause systemic immunosuppression, is immediately apparent to the patient. We know that anti-TNF therapy works rapidly in most patients, within a couple of weeks if you give injectable anti-TNF therapy. There's every reason to think that oral anti-TNF therapy with V565 would have a similar speed of action, so you only need a short study. At this moment in time, there is no option for long-term treatment. What I say to patients is that if they're responding to oral V565, that is a clear indicator that they are likely to respond to conventional, injectable anti-TNF therapy, and that is the logical next step for maintaining remission. At this moment, it's still around the corner, but at some stage in the future, although not linked to this study, we will be able to use oral V565 for maintenance therapy. Patients who come to your clinic with Crohn's disease that is active, then consider oral anti-TNF therapy as part of the HarbOR study. Join the international community in this really exciting study, which offers the new horizon in treating patients with Crohn's disease with gut-specific immunosuppression.